Patient education. Patient education is an important nursing role. When it's done appropriately, it can reduce healthcare costs, improve the quality of care, and help change behaviors that improve the quality of care. Make sure that you always document client education in the medical record. Document what you taught and the client's understanding. Purposes of client teaching would be maintenance and promotion of health and illness prevention, which is education provided to increase health consciousness. Restoration of health, which includes activity, wound care, medication administration. Make sure that if it's necessary that the caregiver is there for you to also provide instruction to. Coping with impaired functions will instruct clients on how to live with temporary or permanent changes in their physical or psychosocial function. Our clients have a right to know about what's being done to them. They have a right to know about medications, treatments, procedures, and we should encourage them to ask questions if they don't understand something. Clarify information as necessary to assure understanding. It's also a good habit to make rounds with your physicians when possible. Now, it's not always possible, but when you can, the physicians often will tell the client something that they don't tell the nursing staff, or the client is attempting to get across a message to the physician and they just are not getting their point across. The nurse is often a valuable interpreter at the bedside, in addition to the fact that you really can learn a lot from these physicians when they're talking to their patients. And always verify patient understanding. The domains of learning include learning objectives. You need to figure out what it is that the client needs to know. Cognitive learning includes intellectual learning. Affective learning is the expression of feelings and acceptance of attitudes, values, or opinions. Psychomotor learning is the acquisition of skills that may involve integration of mental and physical activity. Clients may need to learn more than one domain. Basic learning principles. If a client's not motivated to learn, teaching may have a poor success rate. You may have to overcome psychosocial adaptations to illnesses, and you're more likely to, or the client is more active, the client is more likely to learn when they're active in their learning. You need to make sure that you are taking into account the mental and developmental capacity of the client, because that will alter how the education is presented to the client. Their physical capability can affect their ability to learn. Children, for example, may learn well through play activities or being allowed to touch and handle equipment. Repetition never hurts at any age. And understand that a lot of these clients, when they're sick, they're not feeling well, or they're in pain, that presenting information in small amounts can be preferable. Make certain that you eliminate distractions and provide comfort as possible to improve their learning. If they're hurting, they're not going to be paying attention to you. If they have been in the same position for a long period of time and their butt is starting to tingle and get numb or cause pain, they're not going to be paying attention to you. We always teach using the nursing process. We assess what the client needs to know. We diagnose by integrating clients' learning needs with the learning principles. We plan by establishing the learning objectives. We implement by teaching with a variety of methods to help ensure learning. And evaluate, determine the client's understanding, and reinforce any teaching as necessary. There's several instructional methods listed here. Also realize that there are a lot of written materials that are available for your clients, and sometimes this is a very good way to pass on patient teaching information. It's something that they can go back and look at or refer to later. But make certain that it's in the correct language and that it's at the appropriate reading level. There's computerized technology. They can go online and look up information. And there's also a variety of audiovisual materials to help with their learning process.